Your goal when selecting an approach stroke is to reach the victim as quickly as possible with enough reserve energy to rescue and tow the victim to safety. In all cases, you need to have your rescue equipment on and ready to assist you. To reach a victim, you should either use an approach crawl or a breaststroke. Which one you use depends on several factors: the distance from the victim, the number of people in the swimming area, the concentration of people between you and the victim, the condition of the victim, and your strength and condition. Holding a tube during the approach will allow you to manipulate the apparatus and move relatively quickly. It will also help you to maneuver around swimmers in a crowded pool and over lane lines. In any instance, keep the tube in front of you. For longer distances, unless there's a possibility that the rescue tube will become caught on something behind you, allow the line to trail behind while you approach the victim. The crawl stroke allows the quickest approach. If lane lines are between you and the victim, hold the tube in one hand and stroke over the lane line, pushing it down as you swim over. These approach techniques have been proven to date to be the fastest method to reach a victim.
Now we'll begin to show you the skills you'll use in rescuing a victim in the water with your rescue tube. The following skills are easy to learn, however, they will require continued practice through in-service training.
As you perform any rescue, keep the rescue equipment between you and the victim at all times. For an active victim, approach from the front. Bring the rescue tube in front of you, turning it on edge. Hold the rescue tube with one hand at the nose and the other hand in the center. Extend the tube to the victim by pressing the nose across the front of the victim and under one arm. Push the arm down on the tube to help the victim hold the device by trapping his arm over it. You may even have to remind the victim to hold onto the tube, or you may need to hold his arms around it yourself. Give reassurance as you tow him to safety. With this rescue, approach the victim from the rear and push the nose of the tube across the victim's back and underneath the victim's arm. Take your hand off the nose and place it on the victim's upper arm. Press the arm down, trapping the tube, and tow the victim to safety. Remember, always keep the tube between you and the victim.
Many variables need to be considered when rescuing an injured conscious victim. You may need to modify your rescue methods to suit the type of injury. You want to avoid moving the injured body part while providing adequate support to the victim.
To rescue an injured, conscious victim, approach from either the front or rear, as you would for any active victim. Place the rescue tube under the victim's armpit on the opposite side of the injury, so as to avoid bumping or moving the injured body part. Hold on to the rescue tube and tow the victim to safety.
Okay, all right.
To rescue multiple victims, approach from the side. Grab your rescue tube from the nose and push it between the two victims. You can then tow them to safety.
Hang on. Nice and relaxed.
If the victim grabs you in a way that places you at risk, take a quick breath and submerge, pushing the rescue tube up and into the victim before swimming away underwater. When you resurface, assess the situation and make another approach if necessary. In this situation, the victim is not struggling, and you've determined that there are no signs of spinal injury. Place the tube between you and the victim so that it crosses the front of your body. Place your left hand on the center of the tube. Reach over the tube with your right hand while submerging the tube slightly with your left hand. grasp the victim's wrist with your thumb on top. Turn the victim face up by pulling the arm down and then back up toward the surface. As you're doing this, you're pushing down to submerge the tube while pulling the victim's wrist just past your ear, pulling him onto the tube. Once the tube is under the victim's back, release hold of his wrist. Place your hand on the victim's forehead and tilt it back to check the airway and breathing. In this approach, you come up from behind a victim who is face down in the water. Position the tube so that it crosses in front of your body. Submerge the tube with your left hand while reaching with your right hand to grab the victim's right armpit. Pull her over the tube until the tube reaches a position just below the shoulder blades. Then reach over the victim's upper arm and place your right hand between the top of the tube and her back. Move to the right side of the victim's head, place your left hand on her forehead, and tilt the head back to check the airway and breathing.
Time is of the essence when rescuing a possible drowning victim. At the YMCA, we advocate in-water rescue breathing.
To determine whether the victim is breathing, level the victim and then tread water hard enough so that you can place your ear close to the victim's mouth to listen for breathing sounds and see if the chest is rising and falling. Do not submerge the victim's head or turn it towards you. If the victim is breathing, tow him to safety. If the victim is not breathing, tilt the head back to open the airway. Take out your mask, making sure the dome is pushed out and the one-way valve is attached. Rinse it in the water and shake it to remove excess water. Position the resuscitation mask over the victim's nose and mouth, making sure you maintain a good seal, then proceed with rescue breathing while moving the victim to safety. To rescue a submerged victim, dive and approach from the rear and grasp him by the armpit. Bring the victim to the surface with a single or double armpit tow. Once on the surface, position him on the rescue tube as described for the passive victim with an approach from the rear. If the victim is not breathing, perform rescue breathing while towing him to the side of the pool or to shallow water.
Once you've been able to bring a victim to the side of the pool or exit area, you still need to get them on deck quickly to continue care. The following are some techniques for doing this.
If a victim is conscious but very weak, assist her to safety. Stand next to the victim, pull the near arm across your shoulder, and secure it by grabbing the wrist with your far hand. Your free arm should support her waist. You should be able to walk the victim to safety. The one-person drag is one of the quickest and most efficient ways to carry either an unconscious or exhausted conscious person from an open body of water. Start by reaching around the victim, arms under the armpits and grabbing your wrist with the other hand to lock your grip. Lift the victim and walk backwards, dragging her. Be careful to lift the victim primarily using your legs and arms to avoid injuring your back. For a large, heavy victim, it might be easier to reach around him and grasp each of his wrists, holding his arms against his chest. You can use a ladder exit when a victim has an upper extremity injury or needs your support to exit the pool safely. Transport the victim to a ladder. Instruct the victim to step onto the ladder with both feet and grab the pool gutter or the ladder railing with the hand of the uninjured arm. Position yourself behind the victim, then reach around her with both arms and grab the lip of the gutter or the ladder. Squeeze your arms against the victim to stabilize her on the ladder. Position your chest close to or against the victim's back or hips as you climb up the ladder with the victim. This lift is used primarily in deep water. It is best performed as a two-person lift, but it can be done with one person with these modifications. Reach for the side of the pool to support the victim. Lift the victim's hands onto the deck, one on top of the other, and then get out of the water. After you've positioned yourself on the deck, grab the victim's wrists, then lower her before lifting to gain momentum and to make the lift easier. Do not submerge the victim's face. Keep in mind that her head may be leaning forward. Take care to lift the victim straight up to prevent her head from possible injury. Lift with your legs, not your back, to prevent injury to yourself. As the victim clears the deck at least to mid-thigh, step back and lower her slowly to the deck, placing your foot under the victim to prevent her head from hitting the deck. Roll the victim onto her back to begin emergency procedures. If two people are available, each rescuer takes one of the victim's wrists and upper arm. With coordinated movements, the rescuers lift the victim onto the deck and continue with the procedures described for a single rescuer lift. The speedboard method is a good alternative for removing a conscious or unconscious victim from the water. It is especially effective when victims are difficult to remove because they have a lower extremity injury that is not a suspected spinal injury.
Ready? 1, 2, 3.
Rescuer 1 should approach poolside or exit point with the passive victim. The second rescuer meets them with a backboard, having the chest straps open. She then inserts the backboard vertically into the water, foot end first. Rescuer 1 prepares to transition the victim onto the backboard by holding the victim with the closest underarm while submerging and removing the rescue tube with the other hand. Rescuer 2 allows the board to rise up in the water at an angle, and the victim is slid onto the board. Rescuer 1 applies the chest straps so that they are tight enough to hold the victim in place. Rescuer 2 stabilizes the board with both hands, as Rescuer 1 communicates the count of when to lift and remove the victim.
2, 3. Up. Ready?
As Rescuer 1 pushes down on the foot end of the board and shoves it forward, Rescuer 2 lifts up with her legs and moves back, sliding the victim out of the water. The victim's feet and the board should be completely on the deck and away from any standing water in case you will be using an AED. Assess the victim and prepare for emergency care.